What are the long-term effects of infidelity trauma? When we talk about infidelity trauma, it can have deep and lasting impacts on a person's mental health. These effects often go beyond just the immediate emotional pain and can significantly affect psychological well-being, relationships, and daily life. One of the most common long-term effects is the experience of intrusive thoughts and memories. Individuals may find themselves repeatedly reliving the traumatic event, which can be incredibly distressing and disrupt their ability to concentrate or find peace. Emotional distress is another significant consequence. Many people report chronic feelings of sadness, anxiety, and irritability. The betrayal often shatters trust and self-esteem, leading to ongoing emotional turmoil that can make individuals more vulnerable to mood disorders. This emotional fallout can also lead to hypervigilance, where a person feels constantly on edge, anticipating further betrayal or harm. This heightened state can manifest as intense anxiety or even panic attacks. To cope with the distress, some individuals may engage in avoidance behaviors. They might steer clear of places, activities, or people that reminded them of the infidelity, which can limit their social interactions and overall quality of life. Additionally, some may experience emotional detachment or numbing, which can hinder their ability to connect with others and from intimate relationships. Physical symptoms can also arise from infidelity trauma. Unexplained headaches, stomach aches, or other bodily complaints may persist long after the event, illustrating the mind-body connection in trauma. Mistrust is another long-term effect, not just towards the unfaithful partner but also towards others, complicating future relationships and social bonds. For some individuals, the trauma of infidelity can be severe enough to meet the criteria for post-traumatic stress disorder, or PTSD-like symptoms. This includes experiencing flashbacks, nightmares, and negative changes in mood and cognition. The severity and persistence of these symptoms can significantly impair daily functioning and quality of life. It's important to note that individuals with a history of prior trauma may be more susceptible to developing PTSD symptoms after experiencing infidelity. Previous traumatic experiences can weaken coping mechanisms, making it harder to process and recover from the betrayal. Recovery from infidelity trauma highlights the importance of seeking professional mental health support. Therapy can be a valuable resource, helping individuals process painful emotions, rebuild trust in themselves and others, and develop coping strategies to manage their symptoms. Healing is often a gradual process that requires addressing both the emotional and cognitive impacts of the trauma. In summary, the long-term effects of infidelity trauma can be extensive. They can affect emotional health, cognitive processes, physical well-being, and interpersonal relationships. Recognizing the potential for PTSD-like symptoms and seeking appropriate care is crucial for recovery and regaining a sense of security and self-worth.